and depending on their locations. So now if we have a posterior limb, internal capsule, lacunar front frock, one thing I want you guys to know that's going to be unilateral. Unilateral means on one side, not on both sides. So that's going to be here, motor impairment, and it's going to be pure motor stroke. So not going to any visual sensory defects. Now with your MCA, ACA, and other other arteries, we're going to get basically like a lot of defects. So your motor defects, your sensory defects, your visual defects, and your speech defects. Okay, so like 4 defects. Okay, so essentially we're going to have contralateral muscle weakness. That's going to be your face, arm, and legs if it's MCA. Okay, revise your homunculus if you're getting confused in which parts. Okay, an eye deviation towards the side lesion. So what does that even mean? So if I can just draw a diagram over here, you basically have your eyes over here. I'm just drawing one eye, okay, and then your medial rectus and your lateral recti over here, and both of these kind of go into this thing called a MLF, so medial longitudinal fasciculus. So that's going to be over here, and this is going to be a PRPPF, so parapontine reticular formation, and we're going to have over here a frontal eye field which kind of connects on the other side. So these essentially allow your eye to look left. Okay, so you're going to be looking left when you stimulate this. Your eye, let's imagine this is your eyeball. Your eyeball is going to be looking left. Of course, we're going to get a stroke. We cannot look left, so our eyes is going to look towards the right. So if you get a stroke over here on which is controlled by frontal eye field, you're going to be looking towards the lesion. So that's a brief summary, but do revise in your anatomy if you're not able to follow along. This we said we spoke about like your motor defects. Sensory defects, we can also add that in. We spoke about eye defects now. Let's speak about speech. Now, if it involves your dominant hemisphere, we're going to be getting aphasia. If it involves your non-dominant, we're going to get hemineglect, where you do not recognize a half of your body that is involved. Of course, we can also get some eye defects, so homonymous hemianopsia, which can also be there as well. So your motor, sensory, eye, and speech defects are really the key over here. Then we can see anterior cerebral artery occlusion over here. So anterior cerebral artery occlusion is going to be contralateral somatosensory and motor deficits, and we can also see abulia, so we're going to be a lack of will or initiation, and dyspraxia, emotional disturbance, urinary incontinence. So dyspraxia is basically a development of discoordination, so this commonly affects coordination over here. Then we can see also vertebrobasilar lesions, so supply to brainstem, so this is going to lead to hemiplasia, ipsilateral cranial nerve involvement over here. So yeah, we can get basically your ACL again, revise your homunculus. We are not following. So basically, some motor and sensory defects of your legs essentially over here, and we're gonna also your front part of the bodies are also bulia, so your motivation and also involved for coordination of stuff. Vertebral insufficiency is going to be contralateral heminopsia with ipsilateral cranial involvement. So that's going to be really important that we get contralateral weakness or contralateral sensory deficits or contralateral maybe eye defects, but we're going to be getting ipsilateral facial defects. Guys, one thing I want to speak about hemorrhage over here. If it's a young dude, we can think about subarachnoid hemorrhage or subarachnoid intracranial parenchymal lesions or subarachnoid lesions. So that's going to be essentially like your AVMs, your tumors, and all that good stuff. Aneurysm, trauma, AVMs over here. So this is going to be also seen over here, and then we're going to be seeing that, let's say, a 65-year-old man, he comes over here with a right side weakness and numbness after several minutes. Patient is now experiencing nausea, vomiting. He smoked half a pack of cigarettes. And then we have reflection in the right upper and lower extremity. Sensitivity is decreased on the right. Saying he has mild artery. What's the cause? So it's going to be on the left. Okay. So me left hemorrhage, intracranial hypertension. That's because he's 65 years old. If he was 40, we're thinking MCA. What's the most common cause? What lobes are most commonly involved in cerebral amyloid angiopathy, which is going to be parietal or occipital?